Welcome to Brain Pain, where we discuss everything psychology. As I do at the beginning of every podcast, I want to remind you that I am not a therapist. I'm just a guy with a master's in psychology, working on his PsyD, which is a doctorate level degree. This is not meant to replace any therapy, and I encourage you to go get help if you feel you need it. Today, we're going to talk about the cost of mental health care. And out of necessity, that means that we're going to talk about the cost of health care as well, because mental health care is just part of a bigger healthcare picture. Before we get started, though, I want to make sure that everyone knows that if you're listening to the podcast, you can see my lovely face on YouTube or on Odyssey. Due to the nature of YouTube deciding to not publish certain kinds of content, I do not know at what point they may decide to limit or completely get rid of discussions about psychology, or in turn take a stance where they block or disallow video that they do not agree with. So I'm also publishing on Odyssey, odyssee.com, where you can find me there too. The links for those will be in the description of the podcast. So just take a look if you want to see my face. It's all the same content. And I found that people that listen to podcasts don't necessarily want to see the face behind the voice. So let's get into it. I want to point out as we get into discussing healthcare that I'm talking about healthcare based in the United States. I'm not familiar with how it's run in other countries in detail for a lot of things. I do see some anecdotal evidence of how other countries have chosen to pursue healthcare, and I want to keep it clear that I'm discussing how it's done in the United States. But some of what I'm going to talk about, or actually quite a bit of it, is actually quite universal. Now, when we talk about healthcare in general, we have in the United States a healthcare system that is, I won't quite say assembly line, it's more modular. So you go to a doctor, the doctor decides, hey, you need an MRI or you need a CT or you need a medication. And then that doctor directs you to another module, whether it's to get the MRI, to get the medicine, those types of things. In the case of mental health care, it's more difficult to run the healthcare system at scale. Now, the general physical healthcare, you're talking about the ability to do that modular breakdown of the care, and therefore you can do it at scale. So a doctor finds out you have something wrong with your foot, and it's beyond just an average strain or anything, then they can send you to a specialist who knows everything about the foot. Healthcare is built like that on purpose. That way you can process more people more efficiently and get the best healthcare. Mental health care does that to some degree, but if you go to see your therapist and you have a specific mental disorder, such as one of the common ones I've read about is if you're looking at borderline personality disorder, that is a very difficult mental illness to treat. It's almost as difficult as a therapist to deal with the therapy of borderline personality disorder, which for the rest of this podcast, I will refer to as BPD, because the same things that a loved one would deal with or a friend would deal with for someone who has BPD, the therapist also has to deal with and try to help this person get their mental disorder into a place where they can live a satisfying life. Now, when we talk about scale, a doctor can see several patients a day, help them either get directed to the right place or get a treatment. So if I go to a doctor and I have a broken leg, well, I get the treatment, it heals, and I'm off with the rest of my life. Mental health care, on the other hand, there's times where someone loses someone close to them or they experience something traumatic and they need to go see a therapist specifically for that for some period of time. And then they can move on with their life and the therapist kind of falls to the wayside. But when we're talking about severe mental illness, this can be a lifelong need. And that's what makes it so difficult to run at scale. So you can't you can't have a generic pipeline. Each person experiences their mental challenges and their challenges to their mental health in different ways. And so this requires a lot more individual custom treatment. Let's talk about some of the reasons that we're in the state we are in the United States. And the first one is not what anybody thinks I'm going to say, at least not most people. But people don't prioritize healthcare in general, let alone mental health care. We as a society have a tendency not to talk about it, to treat it one of two ways. We tend to treat it as something they should just get over or we don't want to talk about, which doesn't work. Or we tend to bask and dwell and sit in our mental health challenge, whatever that happens to be, and look for sympathy. This is part of our society. This is not what it should be, but it is what our society tends to do. Now, when I say people don't prioritize healthcare, I have seen people, now when I say people don't prioritize healthcare, I want to start with why we're having this conversation. We're having this conversation because recently I've had a lot of conversations with people about healthcare and mental health care specifically, because with the things that are happening around COVID, a lot of people are starting to have to deal with themselves. They can't escape as much as they used to, or distract themselves, or avoid facing whatever it is that sits at the core of any challenges they have, or due to increased isolation that they're not used to, they're facing new mental health challenges. And now all of a sudden cost becomes an issue. Now, when I say people don't prioritize healthcare, some of the people who are telling me how terribly expensive healthcare is have a new giant screen television that they bought on credit. They have new iPhones. Their car is a late model car. They've just done upgrades to a house or bought a house in this crazy housing market. And they spend all this money on other things first instead of their health. And that's both mental and physical health care. Now, I want to make clear, I've been in the healthcare industry for over 25 years. I'm almost 30 years. I've been working in the healthcare industry. And I've seen it change dramatically, not all for the better. And something I realized, and it took me a long time to realize, so I want to make sure everyone understands I've been just as guilty of this as other people. This is not me saying, oh, look at how great I am at all. This is me saying, this comes from a place where I was not prioritizing healthcare. First of all, we have to look at mental health care as a part of overall health care. Your well-being and your health, your mind is connected to the body. And when the mind is not healthy, the body suffers. And vice versa. When the body's not healthy, the mind suffers. And one of the things we don't do, at least in the United States, is we don't save money. We are consumers. And so that's why we have the new iPhone and then complain that we don't have enough money to pay for aspirin or anything else. And I want to make sure we're all so clear. Listen, I know everybody knows somebody who is in very, very dire straits with money, and it doesn't matter what they tried to do because they can't even put food on the table and they don't have all that stuff. We all know those people. We all know those people that have that type of situation, or we know of them. And I'm not talking about people who are struggling on that level. What I'm talking about is the average American. And the average American could save money if they chose not to go buy every single thing they saw that they wanted, if they decided to limit how much money they were going to spend on credit. So we don't save for healthcare. But if we did, we could change the healthcare as we know it. So if you save your money and then you got sick, you could pay for most people could pay for most of their health care if they just simply set it aside, and it would be less money than they pay in insurance when you take copay and what they're getting taken out of their check on a weekly or monthly or however often it's taken out basis. The reason we originally had insurance was to prevent catastrophic illnesses from bankrupting us. That was the purpose originally from insurance. Now what we're actually doing is we're in kind of a Ponzi scheme that everybody who's healthy this month pays into the system so that they can pay for the people who are ill. And because we won't save, we have to have very extensive insurance, which is very expensive. And in World War II, I believe, is when health insurance started being tied to an employer because they weren't allowed to change wages. So one of the things they could do to attract workers because there were a limited number of workers, they could attract someone to come work and help you produce for the war, was you could offer them life insurance. You couldn't pay them more because the wages were frozen. So knowing that history, that kind of changed our mindset, right? Not surprisingly, it just became part of what employers were expected to offer if I'm going to take a job. The other thing that affects this is, with that insurance idea, is this entitlement. I'm entitled to healthcare. I'm not going to get into the argument over if healthcare is a human right or not. I have my own opinions, but I think the reality is that we don't treat it as such, and we need to live in the real world, and we could actually, again, change healthcare by saving our own money and basically insuring ourselves, and then carrying, high deductible insurance where they're only paying out in the case of a catastrophe, so that if I have some huge life-altering illness, that I can still survive. I can still live somewhat of a lifestyle that is not destitute. Because if we save our money and we take healthcare in our own hands, something a lot of people don't know. If you go in and you price let's just say an x-ray. In the United States, if you go to a hospital or an imaging center, you can price them and tell them you're paying cash. That will be a lower price than the insurance pays. And there's a whole lot of reasons for that. A lot of it has to do with political things that are happening. Some of it has to do with how the insurance company manages to operate in a state across a number of various cost of living areas. There's a lot of things that tie into it, and you'd have to get into it with a financial expert to explain it all. But basically, if you're going and you're paying out of your bank account, it'll be cheaper than if you're paying with insurance, or even claiming it on insurance for a high deductible healthcare program. And I point this out because that leads to the concept of the single payer system. And at least in the United States, a single payer healthcare system has some real problems. And if you want to see an example of the government-run healthcare, look at our Veterans Administration. The problem is that people think that if we get to a government-run healthcare system, we will enjoy the same healthcare we have now, and that is a fallacy. And why is that a fallacy, John? I'm glad you asked. The reason that healthcare being as good as it is in the United States today, which overall it is very good. And I can say that because people from all over the world who have the money come to the United States to be treated for anything serious. Cleveland Clinic, I know for a fact, has royalty that comes in. The Texas Medical Center deals with quite a bit of royalty from the Middle East, as well as all of our Congress and all the people who can afford the best health care. A lot of them go to the Texas Medical Center, even if they're from other places in the United States or world. And that's because they have a lot of experts that have the best technology available to them, and even some experimental items. But that all costs money. So first, let's start with the easy stuff. The cost of a facility. To have a facility that can handle diseases, surgeries, etc. And in the case of mental health, you have to have a place where you can deal with the most extreme mental illness, where people are violent and dangerous, down to the person who's dealing with addiction, and to the person who maybe is just dealing with severe depression. These cost a lot of money. There's a lot of codes that are required for them. While I have some issues with what our Medicare and Medicaid system has done, one of the things they have done that I think is a very positive is they have requirements for the type of healthcare that can be given so that it stays modern and up to date, and so that we're getting the best tested. Well, in the medical field, we call it evidence-based practice. Okay, so it means that we have evidence that whatever we're going to do for a patient results in the best chances of their recovery. So to meet those requirements, there are a lot of guidelines, and it's very expensive. Then there's the cost of equipment. Whether it's an MRI or a CT, the technology changes so quickly that really these items are replaced every 10 years. And I can tell you from personal experience that an MRI will cost $1.5 million, CT about $1 to $1.2 million. And that's just the way it goes. And then you have to think about all the other equipment that's in a hospital. The same goes for mental health care. They don't have all the imaging equipment, although for a lot of mental health care issues, you do need what they call a functional MRI, which will look at how your brain works to see if there's a problem. There may be DNA looked at, which is expensive. All the equipment associated with DNA testing is very expensive. So you have that all as overhead. Then you have the people. Now, a nurse goes to school for 4 years and then has to deal with patients. And they love what they do for the most part, but there are some challenges. I mean, think about the fact that most of the, I'm going to call them cutting edge hospitals for both mental health care and physical health care, there's certain areas that every 3 to 5 years you get a year off paid, because the mental strain of dealing constantly with people in severe mental or physical situations wears you out. You can only see so many people struggling for so long before you need a little break and you need to recover yourself. Specifically, the first one that comes to mind is physical, and that's the children's hospitals that deal with children that have low survivability cancers. You can only watch so many children die before you need a break and you need to get away from it. Then you think about the fact that doctors, they go to school typically around 12 years. They're really not fully functional for 15 as far as income, 15 to 20. So you have somebody that really isn't hitting their stride till they're 40. Let's just say around 40. So if we go into a system that, well, doctors shouldn't make so much money. Okay. The problem with the result is, if I'm a bright young man who would be the best doctor and cure cancer, I'm not going to be a doctor, because I don't want to go through all that school and all that struggle to cap out at 60 or 70 or even $100,000 a year, especially when you see what a doctor does. A lot of people don't understand a doctor's life. I watch doctors who are at the hospital at 6 a.m. They leave at 6 or 7 p.m. They stand call, so they may be called in for certain periods of time. They rotate through that. And that's all part of being a doctor, but that's also why they're compensated as well as they are. That and their knowledge. And then you go into a specialty, which is even more schooling, even more training, even more certification to be board certified in a lot of these things. That's a lot. That is your whole life. And you might have some hobbies, but you don't have hobbies like so friends of mine, and this is anecdotal, but friends of mine who are a truck driver or even other people in the medical field, transporters, chefs, they go home, that's it. That's the end of their day. And then they can go do what they want to go do. Doctors, it's not quite that easy. It's not that simple. And so if they're not going to be compensated in a way that they have the potential to really make a fantastic living, it's not worth it to a lot of people. Now, you'll still have those doctors who have it as a calling and we're still really great, but it's less likely. On top of that, right now, especially in the last 2 years with COVID, you have people leaving every aspect of the medical field. That includes people who work on the equipment, who repair it, all the way up to the doctors and nurses. And some of that's political, but a lot of it is just there's so much demanded of them that they want a life that they can enjoy as opposed to every day feeling like they've been hammered, just hammered and hammered and hammered with the work that they do, which snowball effects, right? So the ones that are left have even more work to take care of. We have more sick people. We have more people that need attention. And it just kind of becomes a problem. That's why it's expensive. And if you think about mental health care, if you're someone who is trying to help people, you revel in the people who find their way, let's call it. They start living a satisfying life. They find positive ways to deal with their challenges. But there are always people who are really in the middle of that dark place of their challenges, of all the things that they face every day that might incrementally improve, but it's a constant. It's a constantly being hit with negative energy, so to speak. That constant dealing with the problems that their clients deal with and trying to help them and watching some of them self-sabotage and some of them not really understand what they're trying to accomplish. That's why therapists are in therapy, is to make sure that they can keep an even keel, to make sure they have an objective person to help them not get lost in the woods while they're trying to help others. Another thing that comes to mind is something that's been said in a number of different places, not just the healthcare world, but in a number of places. And that's that old saying, we do 3 types of work. We have good work, we have fast work, and we have cheap work. You can pick 2. Because good and fast is not going to be cheap. Good and cheap is not going to be fast. And fast and cheap is not going to be good. In the United States, we have good and fast healthcare. We have access. It's a bit anecdotal, but you can see, well, you won't recently, but for years and years and years, we hear about everyone that lives on the Canadian border coming across the border to get MRIs and CTs because there's a wait list that's too extensive for what they have going on, whether it's cancer or just to know if they have cancer, to know how aggressive it is, things like that. There's waiting lists. A friend of mine once told me, and I was totally blown away, her daughter broke her arm on a Friday afternoon. They took her to the hospital. They splinted it and wrapped it up and told her to come back Monday. On Monday, it had already started to heal, so they had to re-break it and set it. And that was because the doctor was not available. Now, I was told if it would have been life-threatening, because I had a whole conversation that followed this. If it was something where she was going to die, they had doctors that could keep her from dying. But the bone still wouldn't have been reset until Monday because the person whose specialty was that wasn't available. Now, obviously, in healthcare, we can't do that. When we have people who are in dire straits, we have to have people that are available. And not that any one doctor has to be available all the time, but there are people available in the United States all the time. I'm sure they are in Canada too, so I'm not saying anything like that for mental health, and possibly in Canada more so. But we have instant access. If I need an MRI, I can get it tomorrow. And it'll be a top quality MRI, so it's good and fast. It means it's not going to be cheap. So now that I beat up why it costs so much and where that money goes, I want to focus more on the actual mental health care and some things I see as a problem in the United States. So I've always said in any country, there's a couple things that the government should not outsource. One is their military. Whatever you have for a military, you should never outsource that. That should always be controlled by the civilian government. Prisons should never be outsourced. That should always be under the control of the government. In the United States, you have both federal and state, but it still should be under government control. It should not be outsourced. And we're seeing some problems with that where we have outsourced prisons, and there's a drive to try and keep the prisons full, and that gets into a whole political situation and the way laws work and the way the laws within the prisons work, to try and keep as many people in the prisons as they can, because that's how a private prison makes money. And private prisons are there to make money. And speaking of prison, we got rid of a lot of our institutions for healthcare, people that need to be institutionalized. We're very much against it. And we have a history that drives that. And the history is that there were government institutions, I think they were private as well, but I know there were government, basically sanitariums. They've had a lot of different names, but basically if you had someone who was really a danger to themselves or others or had a serious mental illness, they could go into a lockdown facility that was run by the government. And there were horrible abuses. People were treated like animals. Now, granted, we didn't have the knowledge we have of psychology now, but regardless, there were a lot of abuses. So there's a lot of resistance to those kind of ideas. The other reason that it is frowned upon is because it costs a lot of money to have a modern mental health care facility. So I learned a lot about this when I was working in Ohio. A large hospital that I won't name stopped accepting, I think they're called street warrants. I might have the name of those warrants wrong. But basically it's a warrant where your family has testified to a judge that you are a threat to themselves, and the judge feels that with professional testimony there is credibility and that you need to be locked up for your or others' safety, which is not a pleasant situation. If you're on the street, even if you are a threat to yourself or others, you don't want to be locked up. It requires a very controlled space that has to meet a lot of requirements. And so this hospital that had taken these street warrants up to a certain point decided it was not financially viable. And so that meant that the other hospitals, one that I worked in particular, that had mental health care facilities in them, started getting more of these, and it became a very difficult situation to manage. The reality is that the hospitals have these mental health care facilities and they do have the lockdowns, but the people who are getting street warrants, the people who have to be locked up typically, and I say locked up, when I say locked up, I should say locked up is such a term that makes people feel, oh, that's a negative term, but they need to be held in a lockdown facility for their own or others' well-being are typically people that had been treated, had been given medication, could come get medication, even under Medicare and Medicaid. So it's, for those who don't know, that means that it's no money out of pocket for these particular individuals because they are typically not earning any money. And so they would have these medications, but then they'd start to feel better, or they wouldn't like the side effects and they would stop taking their medication, which would then cause the problem of them being needed to be picked up again. And round it goes. Unless they do something before they're picked up and they end up in prison. In the United States, a lot of our mental health facilities that closed down, all they did was move the people suffering from these issues into prisons. There are a lot of mental health issues in prisons. This is part of the reason, not the only, but part of the reason that we have the highest number of people in prison per capita in the world. It's because there's a lot of mental health issues that aren't being addressed. And the way a prison functions, even though technically they have mental health care, I'm just going to be candid and say it's usually a joke. People who really need serious mental health care in prison, even if they have a therapist, even if they have a psychiatrist, the environment is not conducive to them ever successfully overcoming their challenges, which then feeds the prisons, and especially if it is a prison for profit, there's no motivation for that prison to help the individual get better, because once they're released, they'll come right back into the system, which of course means more money. So how do we fix that problem? I think it's a complex problem that's going to take a lot of conversation, and we need to have the conversation, and we need to work through it. But I think there's a place for government asylums. I think they would need to fall under the guidelines of the Medicare Medicaid plan that we have in the United States. And I think, don't get me wrong, I think there is a place for private lockdown facilities. But those are the ones that people go to voluntarily. And I think there's room for all of that. And I think there might be a mix that would really be helpful. But I also think that we need to, outpatient centers, more mental health outpatient centers I think an investment in the outpatient mental health care facilities by us as a country, as individual states, could reduce the number of people in prison. And all in all, reduce the human suffering. But how does that manifest? Well, that's where it gets tricky, because here in the United States, once the politicians get involved, it becomes dicey. So I guess I'm saying I don't have the absolute answer, but I think it needs to be revisited. And we need to look at models from other countries and see what works and what doesn't work, see what's working in our country and what's not working, and put together evidence-based practices that work. Now that said, that's for the extreme cases. That said, in general, how can we increase our mental health, just as humans across the globe? Well, in the United States, again, I would say save money. But then beyond that, physical exercise. I'm guilty. For a long time, I didn't take my physical well-being as part of my mental well-being. And since I started working out 5 times a week, actively working out, I've seen my mental health improve. But also social interaction. Make sure you have a social group. Find your people. Be in contact with them on a regular basis. Make sure that they're healthy relationships. Because, a lot of people who are dealing with mental health issues or even just depression tend to accept any relationship as a good one when it isn't necessarily. And also, get off social media. I don't mean completely. Well, for some people, they've gotten off it completely and found their lives significantly improved. But I see people who are horribly unhappy, who are friends of mine. So this is anecdotal again, but They're friends of mine, and I'm like, well, how much time are you spending on social media? Oh, not that much. But then when they actually think about it, they're like, wow, I'm on it all the time. I'm on Facebook all day. I'm on Instagram all day. I'm all chasing this artificial high that you're connected to everything when there's no, what I'm going to call an intimate connection. There's no real solid connection with all these people. You just have volume. You don't have quality. And quality relationships at the end of the day are typically what help you navigate the highs and the lows of life. Now, that's all my opinion. So I'm going to wrap up there. Remember that I love you. Take care of yourself. Rock on.